Hello, my friends. Today we're going to be discussing some secrets of the healthcare realm. It is a bit of a mysterious place since it's a little bit difficult to get into unless you are actively trying to die the hospital. But we're going to share some secrets. Recently, Buzzfeed came out with an article, and they did people in the medical field are sharing things only from their jobs that you'd only know if you read them. Some of them are good, some of them are like boring. So we are going to take to them. We're going to add to them. I'm pretty sure everyone in the chat, some people on our panel, we're going to be able to add to them, and hopefully it will be a fun, informative, and tea spilling adventure. All right, Rut, welcome. We have
it will be
Scott,
a fun, informative,
and Bridget.
Tea spilling
Let me
adventure. All right, Rut, welcome.
Hold on one moment. Do you want to introduce yourselves? I hear myself in a different place, and I need to figure it out.
I think that might have been me.
Oh, okay, perfect. I was like, where am I hearing myself from? I thought I closed.
I was
all
like,
these
can I
dumb
monitor?
tabs.
Can I monitor what's going on FaceTime on YouTube on my new little device?
Yeah, I'm
yes.
trying to find your video too. I don't know if because you just went live, I can't see it yet.
Let's
You
see.
can hit refresh.
Yes.
Oh, did you want introductions and show?
Yes, you if you would like to. Otherwise, you can remain completely anonymous and just these random people that are here. All is well. And do let us know in the chat what your as you're going through it. You can vote on if you knew about this or not. Some of these. I think one of these or two of these. I was like, oh, I didn't even know that. Hopefully we get some tea from some of you. I'm sure Scott and Bridget both have other things that we can share because, like I said, this list is like sort of okay, but it's a little bit dull. I feel like we could have gotten a lot more spicy, and I'm sure some of you have extra secrets. So, Scott, would you like to start and introduce yourself?
Sure. Hi, everybody. My name is Scott. Hi, I'm Nurse Scott. I have the Nurse Scott YouTube channel, and I have been sidelined with a bad back for the last 6 years. I'm an emergency room nurse, though, of many decades. And I'm back in school now to become a family nurse practitioner. Although this week I'm wondering if that was a good choice or not, because there's a lot to study in pathophysiology, and it's a little bit overwhelming. But
you're doing great.
You're doing great. Hard things, right?
Yeah, patho's probably where I came up with that saying. Was right there. If you are a member, like Second Opinion said, you can use your agree and disagree emojis to let us know if you've heard of these or you haven't heard of these. And the rest of you can use words or emojis or surprise us. Let us know. Bridget, would you like to introduce yourself?
Sure. Hi, I'm Bridget. My YouTube channel is Bridget NP. I've been a nurse for 11 years and an APRN for the past 3 years. I'm an FNP. I've worked in med tele with adults with developmental disabilities at an ALF and in a psych facility.
Perfect. And thank you for introducing yourselves, my beautiful panel. And all of their socials are linked down below. You should definitely go check out their YouTube channels. They're awesome humans. So my background as a nurse is on med surg, so like adults with GI, liver, and kidney issues, and then pediatrics. And that is my child. Someone will be coming to retrieve her soon. She's having a day. Poor baby. So Scott, would you like to start us off with this article and read the first one, and then we'll switch off? I realize that I always present the articles, and that's probably a stupid way to do this because other people can also, I believe both of you can read. So if you would like to use the first one, Bridget, you'll do the second one, and hopefully by then someone will have acquired my child.
All right. So the first one says, I used to work in a private practice plastic surgery clinic, and the things I saw there were repulsive. The doctor would shame patients into scheduling surgeries with him. The first question he would ask you is, in your preoperative appointment, was what you did for work, and would provide a quote based on that. He made us.
Oh, sorry. I was trying to make it bigger for you, and then I ruined it. Go for it.
He made us reuse surgical supplies that weren't meant to be reused to cut costs. He was so mean to his staff and would overwork us to the point of exhaustion with no breaks during surgical days.
Have we seen this? Yes, and that child crying is the epitome of mood. Yeah, for real. So I'm not shocked by this, especially in plastic surgery, because that's a private practice. Plastic surgery it's a different beast. It's people who are going usually for, I'm hopefully in this case for cosmetic things. Hopefully this wasn't people who needed something to correct something that went wildly wrong. Obviously everyone is very much entitled to be able to have surgery safely. But still, I feel like those places are always like a little bit skeezy. For the rest of people, it kind of is weird though how in healthcare you can set your own price, and insurance is the one that actually decides if they're going to pay it or not. So that was the only informative thing I pulled out of that, was you can technically, even though in most cases for plastic surgery you're not getting repaid anyway, doctors can kind of just say, especially surgeons, like, this is how much this is going to cost, and the insurance company kind of can come back and then be like, oh, that's a silly arbitrary amount, we're not going to pay it. Or they're going to be like, okay, like, we will. That's why cost is so not transparent. Chelsea's here. Because they can kind of just pick, and then insurance can be like, yeah, we'll do that, or no, we won't. So it's very arbitrary. There is no set pricing for everything, which also makes it very, very, very confusing. Other thoughts? Did we know this?
Private practice plastic surgery is a tongue twister.
Yes, I did not do well.
So Noralia brought up the point, and that's exactly what I was thinking. If this has equipment that was not meant to be reused, because there is equipment that, for example, dentists use and they disinfect it using an autoclave. But I'm thinking like infection, HIV, Hep C, that these patients are at risk.
Oh yeah, for sure. I didn't even like process the second half of it. Yeah, that's an absolute mess. Usually stuff like that, yeah, you open it in like little packages, and then you only use it if it's been opened from the package from you, and then they send it to like the autoclave and they catch it on fire basically and just let it do its thing. Yeah, or it's one-time use instruments. You don't just like reuse it. That sounds awful. And I'm not surprised, like,
just to be fair, I mean, I don't think this is a good practice, but just to be fair, it may have been autoclaved. It may have been like those scissors and tweezers in the basic set, they use to do stitches and stuff. We always put those in a box, and I think we send them to like veterinarians or some kind of mission abroad, and they autoclave them and reuse them. But they are only single use, but they're good for other things. So maybe it's stuff that they do either doesn't come in contact with the patient, or they do autoclave it.
Yeah.
Or wipe it down, whatever is appropriate for it.
We also have Mira. Oh, hi, Mira. I don't know if you've ever been on one of these.
Hi.
Mira was in
I was able to ditch my last conference because I really wanted to come to this. Sorry for interrupting.
No, you're fine. Mira is, well, I'll let you introduce yourself really quick. Do you want to introduce yourself really quick?
Sure. Sorry to interrupt everybody. Also love Nurse Liz and her Cavalier because I'm a big Cavalier fan.
It's my dog.
Polly as well. Hi, my name is Mira Bhattacharya. I'm currently working in public health policy and disability law, but I'm also an EMT. And I start PA school in 3 weeks. And I have a chronic illness and also am autistic and have ADHD. And yeah, so happy to be here. Not to put a shameless plug or anything, but my friend did make me start a GoFundMe because I've had some really expensive medical expenses that have been prohibiting me from making my first semester tuition, which is due soon. So I've been working 80 hours a week while having chronic pain. And if there's any way anybody could just share my post, it would be really amazing to just do a quick share on an Instagram story or something small like that. Thank you so much.
We will link her down below. And Mira was the one I interviewed for PA stuff. If you saw like my PA pre-interview and all of that stuff. And if you want to feel really bad about yourself, and you are like over 30, you should probably watch that because she's probably done more than you. And it gives you really good perspective. You're like, oh, wow, I haven't done anything with my life. This brought up, I thought it touched on though my first good secret that I knew of, that I don't know if everyone else knows of, that you should probably know of, is they throw everything away after you leave your hospital room. So most things in healthcare are one-time use. So if you are leaving the hospital, please ransack it and just take all the things from it, because they're going to go through it and they're going to rip it all out and they're going to throw it away. So especially if you are having a baby, they can't use any of those diapers that they put in that little rolly bassinet thing. They can't use the wipes. They can't use, don't take the blankets. Maybe just take one. Just take one for memory's sake, but don't take any more than that. And then the gowns, obviously don't take the clothes, but everything that could be thrown away, they will throw it away. So go through it, have at it, take all the tape. You never know when you're going to need all of that tape. Just take it, go for it, have at it. I used to give my patients a bag. Yes, Chelsea.
That reminds me, they do tell us that we can't the patients aren't supposed to take the blankets. I always tell my patients, like, literally take everything in this bassinet, because we're not going to keep it. It will literally go into the trash can the second you leave this room. But with the blankets, they tell us that patients can't take the blankets. We have like swaddles that we give away for free, but the actual blankets themselves can't go. And I always think, like, I am not going to unblanket a baby. Like, what am I going to do? It's like, literally, I'm not going to rip a blanket off of a baby as they're walking out of the hospital. So
Remove the blanket.
I guess we just have one less blanket now.
I would imagine you go through a lot of blankets, because pretty much everyone I know is like, this is the blanket that I took from the hospital. I have both from both of my children. But I did the thing where you take the blanket home and then you put it in your dog's crate to try to like make them used to them. I have no idea if that actually works, but I did that both times. Sorry. They very happily house baby dolls now, and they're perfect. So I'm the problem once again, Chelsea. I am the problem. The people, I feel like on our whole panel between like Scott and me, we're going to be like, we are your nightmare in OB. Like, my whole family is here. I'm stealing all of your blankets. Let's go. Okay.
It's fine. We still love you.
Thanks. Okay, so that's not good. And surgeons, I feel like, usually do work you to the point of exhaustion, because they are very much getting paid for their time, like a lot of money, versus, in primary care, no one pays us anyway. So it's like, oh, it's fine. I'll just take more time, because
let's not forget the big thing, that he's pressuring patients into having procedures.
Oh yeah. And that is, oh yeah. And if you ever feel like that, like, get a second opinion. You know what I mean? Like, because surgeons, you have to remember, it's their job to cut you open.
I have a feeling on these, it's probably upsell. Like, you go in and you want, your eyelids done, and they're like, well, actually, for the results that you want, we really need to do a full facelift, and so they're upselling you. That's just wrong. I will confess, I did go to a plastic surgeon once. I wanted some little small procedure done. I don't remember what it was. It was my
no shame
eyes, or I don't know, something. So, and one of the things a good plastic surgeon has to do is screen patients for body dysmorphic disorder. So before they get addicted to surgeries, you see it on TV where it's like they have one after another, and they never think they're pretty enough or thin enough, or they, whatever. They don't have a very clear image of their own body. That's body dysmorphic disorder. And that's something that the doctor has to say, now, does this person have realistic expectations and good reasons for the surgery? Or are they going to start going down that path of never being satisfied with their body? And there's nothing wrong with it, and the one that I saw actually kind of accused me of that. He's like, you look great. And I'm like, well, I know, but I'm just,
It's like, you're too good looking, Scott.
But I didn't take it that way. I got it. You're too good looking and you're crazy. And I'm like, I think anybody should be able to have whatever it was I was asking about. I never did have it, but
you should be allowed to have whatever done that you want to have done. Like, it's your body. I'm
going to pay you. If you anyway. So this seems like the opposite of that, and neither one is good.
Yeah, not good. If someone's immediate reaction after meeting you, like 2 seconds later, is like, we're going to have to cut that out. Just seek a second opinion. Just go and see if someone else has a different opinion, because they will usually want to cut it out. Just an FYI. All right.
A good surgeon, if you go to a surgeon and they're like, I really don't want to do the surgery on you, that's a good surgeon.
That's a good surgeon.
Doesn't want to cut.
Yes. Michaela S.
I'm sorry.
Oh, no, you're fine. Michaela just gave us a plastic surgery tip. Talk to the other patients that have gone to that clinic and compare cost. Call other plastic surgeons and ask them about price points. So that's a good point too, for like, if they are kind of making up their price, if they don't have like a set fee schedule, I feel like they should be able to pull it out like a menu. You know what I mean? Like, if you go to, like, I would imagine it, like, if you go to get Botox or something, they probably have a sheet of some kind, and it's like, this is how much it is for this many, like, obviously I know a lot about it. Like,
also,
units?
I don't know if it's
Units,
American Association of Plastic Surgeons, or whatever the national organization is. They actually they have the website, and they publish average prices for procedures, so you can get a ballpark figure. Depends on the part of the country, but they do have some guidance on there.
Yeah.
Yeah.
But I
have a link to that if anybody wants. I can dig it up, because we actually work with lowering like financial health care costs for people like needing like medical Botox and things like that. So CMS actually, which is Center for Medicare Services. Sorry, I'm sure everybody knows that, but
No,
they
it's
have
helpful.
to publish that like legally. So those are all policies that I've been learning about. So if anybody wants to hit me up, I can try to dig it out on Tuesday morning because I'm not going to have my computer this weekend.
Yeah, if you find it, just message it to me and I'll add it to the description of this because that would be super helpful. Because I don't know anything like that. Mira, I feel like today you're going to be our Adrian. Okay, no pressure.
Sorry, I've been like a public policy geek since.
No, it's perfect. We need our Adrian. She's on vacation. Very rude, but we need someone who knows a lot about public policy. So I nominate you as Adrian. Good luck. We have a lot of questions for you.
No pressure. No pressure.
Yes, no pressure at all. Miss Letty says yes. Please share the link. So we'll find it. We'll find it and then we'll link it. Would love to have this link to share with my provider at my clinic. If we ever have Neuralia, no time off ever. How dare you? I know. You know, these people, my unpaid employees are my unpaid volunteers. Take time off? How dare you? Clearly, I am not having this surgeon's mentality. You found it? Oh, perfect.
Yep, that's the overall one. If anybody needs specifics, happy to walk them through. That's what I do for half the day at my internship anyway.
Awesome. Love it. All right. Bridget, would you like to read the next one? Boop, boop,
Sure.
boop, 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 boop.
As you were scrolling, I started to choke on my own saliva.
Oh, that's real. I love when I do that. I'm like, just don't mind me. It's my suck swallow reflex. It's just not working. I'm an adult. It's fine.
I work in an outpatient laboratory, and a patient does have the right to decline tests they feel unnecessary or too expensive. There are several providers in our clinics who insist we do all labs in a patient's chart, even if a patient doesn't want all blood work ordered. One provider once told me not to listen to the patient, will always do all blood work she orders. Patients should be proactive, question the need for tests, and have the right to decline if they choose.
Yeah. Yes. So yes, always ask when you go to LabCorp anyway, or wherever you're getting labs they should tell you about how much it's going to cost. And like, they might even know, your healthcare provider should know if they're going to generally cover them. But always ask what they're drawing, and you can always say no. Always. And a good tip that I used to do with my patients who were worried about like, oh, how much is this going to cost, is I used to give my patients a list of what I think is the most important to the least important. If you're going to go have your labs drawn and you're worried about cost, if you only could pick two, please pick these two. And usually it happened to also be convenient because it was the cheapest. It was like the extra ones, the thyroid, like other things that usually got more expensive, but give them a list and then just saying it down. And then if they say, hey, that's way too expensive, you don't have to do those. So you can always, with any medical procedure, decline anything because it's your body. Healthcare should be like a menu. It's not your job to know what's on the menu. That is the people who work there. Here's what it is. Let me explain to you what these things are and what they do. And you get to pick what you want to do. Exactly, Lola. You get to pick the ones you want. There you go.
That's what I was going to say about the last point is it comes down to like informed consent. And it sounds like, and in my experience, informed consent is lacking a very key point to be true informed consent, which is explanation of alternatives. And that's really lacking a lot of times. Like even in my own experience of say, this is what I think you should do, this is my recommendation. And then the quote alternative ends up being something that amounts basically to, if you don't do this, this terrible outcome will happen. And that's the alternative. And that's not really true informed consent. So
no.
Well, you know the old saying, informed consent is neither. That the patient is not truly informed, and they don't truly give consent because they don't truly understand, everything that there is to know about that. So, but we do try. Obviously, we do try to let you know why we're doing something, and you're right. We probably could do a better job.
Also, with informed consent as well. Sorry to interrupt. The other part too is that it has to be informed. So how can you make it more accessible and more informative to people who may need it in accessible format. So, for example, I know one of my bosses went to get a procedure, but they showed him a diagram. He's fully blind. I'm not sure that that's really informed consent. Or if somebody uses augmentative and alternative communication because maybe they are a non-speaking autistic individual, we need to make sure that they have access to their AAC device at all times, right before they go into surgery and right after. And furthermore, also, even if you are a speaking able-bodied person, we talk about consent after surgery. So when you first wake up, we've also been looking into using augmentative and alternative communication so that you can be able to communicate post-operatively. And that's so important.
And just remember, watch me, deaf patients need a qualified interpreter at all times.
Yes.
It's the law.
All patients
Yeah.
who are, if you need any kind of interpreter, it can't be a family, like we're not pulling in a family member.
Well, wait, people who are deaf, who are covered under Americans with Disabilities Act are, if you just happen to speak another language, that's not required by law, at least not in all states.
Well, that's crappy.
Yeah, the Americans with Disabilities Act talks about people with a disability. Deafness is considered a disability. So those interpreters, sign language interpreters, if that's what that person uses, if there are deaf people that have cochlear implants that speak and use that to listen, there are deaf people that just read lips. So someone coming in and moving their hands around isn't going to help them. So you need to identify, this was my area of expertise 2 decades ago, because I became a sign language interpreter in addition to being a nurse. So if that's their preferred mode of communication, they have a disability, you have to accommodate that, a reasonable accommodation. So, in an emergency, sometimes there isn't one. We do the best we can, but just so you know, it's different than people who need another language, spoken language interpreter.
Yeah, for sure.
I wanted to touch on something that Nate said. So he said, I've had times when I paid 3 times more out of pocket for labs than the cash pay rate. And so when I went to the rheumatologist for the first time, it took me like 7 years to finally get a diagnosis of Sjogren's because doctors kept dismissing me. But so when I went to the rheumatologist and they were finally running the labs, I didn't ask because I had health insurance. So I had that false sense of security. Then I got a bill for $500.
Oh my gosh.
So definitely I feel your pain, Nate. And then, so ask about prices like everyone else was saying. And recently I needed to get a mammogram because I was having axillary pain. And because I don't fit the criteria with the insurance. And also the physician had recommended me to go to, for example, Orlando Health versus Simon Med Imaging. They wanted to charge me $725 with health insurance. So then I called Simon Med Imaging and I asked, what is just the out-of-pocket price, like cash price? And it was like $300. So it may be cheaper for you to just pay out of pocket and not even put down your insurance when you're doing labs. So yeah, compare prices. Javier had said he doesn't have insurance. So you can always go to different labs. You can ask at Quest, LabCorp, local labs, and sometimes hospital labs charge more than like Quest or LabCorp.
And see if your health department does them. Sometimes your health department will usually do any like STI screening type of labs. They will usually do that. And it is based on your income. And it's usually quite affordable. My patients usually paid like under $20 for everything. And I've had some people get TB done at your health department. It just depends on what your health department does. But definitely ask about cash price. And yeah, especially for those labs when they start getting weird. And weird is anything outside of like your typical, what's your white blood cell count, red blood cell count, cholesterol, thyroids can get expensive. But when you're starting to talk about like rheumatologic things, anything having to do with hormones, that's going to be bonkers expensive. So just check and make sure and see, and always ask when they say, I'm going to order labs for you, ask what they are. Because a lot of times people are just like, I'm going to order your labs. Will you go get them? Just ask what they are. It's totally okay to take up 2 minutes of someone's time to just be like, hey, what are you drawing? Someone should ideally be saying, hey, I was going to draw this, 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 and this. And hopefully and a brief explanation of what those are and why. And then, is that okay? Is there anything you want to add? Like, is there anything else you were worried about? And then you can kind of talk about it. And when you're ordering labs or getting them drawn, it's totally okay to ask, what will that really tell us? And will it change anything? Because a lot of people, especially I found coming from inpatient to outpatient, I really struggled as a provider because inpatient, they order everything. When you're in the hospital, they just like order they'll say like order a rainbow and it'll look like this. And they'll just fill up all these tubes and it'll like have every test. That is a very different mentality than outpatient. So when I was a new nurse practitioner, I wanted to order like everything because I was scared. And I was like, what if I miss something, blah, blah, blah. And my provider that I worked with, she was usually like, but what are you going to do with that information? Even if it comes back that way, like, is that going to change what you're doing? And I'm like, I guess not. So just think about that.
You were part of
Yes.
the problem, not problem, but they say research shows, how well nurse practitioners do in primary care versus doctors, but they always say nurse practitioners do tend to order more tests.
Well, I was terrified because of that. I was terrified to order imaging.
That's probably
but labs
why.
I wanted to order. For some reason, labs, I was like, I can order all the labs, but imaging to this day, like through my whole thing, because I was terrified to be one of those statistics that over-ordered imaging. Someone's like foot is like sideways. I'm like, I think it's broken, but I'm not sure. Let's look up the ankle rules. We should really check this to see if we need to.
Where's the algorithm?
Scott, I always err on the side of caution.
Yeah.
Like I'm kind of like I was like, you know what? You might as well get an X-ray on that ankle, make sure it's not broken. I don't know. I'd rather be safe than sorry.
Yep. Yeah. Well, because it also comes back to you don't want to be seen as incompetent. Like, oh, your nurse practitioner missed this. So you're like, I'm going to find everything. You're going to come out of here with so many diagnoses.
And
we
are already,
no,
most people, not everybody, we're already put on like this lower pedestal than the physician. People are like, oh, you're just an NP, or, oh, you're a nurse. They don't understand what NP is.
Mm-hmm. Yep. Oh, fun. So takeaways of this, you can always say no, ask what on earth they're doing. And
if you want something run, ask what Rogue was saying. Sometimes people are asking for tests that she hasn't ordered. They want something else.
Yep.
And if you want something else, if you're like, hey, can we check to see if I've got syphilis, or can we, I haven't had a TB test in 5 years, and there's always a chance. So if there's something you're interested in, bring it up. And even if they don't order it, it's a place to start a discussion.
Yeah. And I would say the most common ones that patients asked me to run that I wasn't planning on running is they would want me to do one of those food sensitivity ones. And that was a good opportunity to be like, that doesn't test the right immune system marker. That's actually like all those, oh, take this test and see what food you're sensitive to. Don't buy those. I think we've had a whole episode on that. That is a scam. It doesn't test what you're actually allergic to. So
and
that was a
lot of false positives. So people are restricting their diet for no reason.
Yep. So that was a excellent thing that I usually was able to have a conversation about. And I mean, if they still demanded it, I'll do it. Obviously, you just have to say this probably won't be covered by your insurance. I can't tell you how expensive it is. And hormones. People always wanted their hormones checked. And that was another huge one when we could say, really, if we want to do this, we're going to probably have to the timing is going to be really important here. I'm not sure what we're really going to get out of it. Your insurance will not cover it. If you want to look into that, I would honestly prefer you go to an endocrinologist because I can't really interpret them well. And I think it's important to let your patients know when you can't really interpret what all of these things are that comes back well. But some of them still wanted it. And I was like, I am happy to order that for you. I just can't necessarily tell you what it does. And just be clear about that. Let me see. Noralia said, I also have a side note, would love to see a nursing student panel someday. I have 1,010,000,000 questions. We could do that. Okay.
I type back to her.
Oh, perfect. Most of our shows end up being Q&A for nursing students and new nurses. What's on your mind? Oh, perfect. Yes. And if you have any questions, we'll do a little Q&A at the end of this.
It always ends up there somehow.
Yeah. And on Sundays, I usually have a live stream at night. And I usually I think I'm going to start sending out the link to any panel people who want to come. Attendance is not required, but not like today where it is. And it's much more chill Q&A style. We might have a small topic, but I think we're going to start transitioning into that model. So we just have one chill session a week where we can just chit chat and hang out and just vibe or whatever.
Share our
saying.
wisdom. Share wisdom, experience, and enjoy each other's company.
Get rid of the Sunday scaries. if we're being totally honest, the Sunday scaries don't really happen with me because by Sunday night, I'm so ready for my children to have someone to watch them for me for a moment. I'm like, come on, Monday morning. You mean I get to be by myself for 3 minutes? Yes. Perfect. So that's me.
It's too bad we don't live closer. I'd babysit for you.
We might have to move to San Francisco. It's fine. Joe, if you're watching this.
That's fine. Oh,
Perfect. We'll do it. Okay. Number 3. I will read this one. Nurses. A nurse of over 30 years. Patients have no idea what they're having a procedure for, and therefore what the results mean. This is true. For example, a colonoscopy is performed to look for and remove colon polyps, which can, over time, grow into cancerous tumors. It's scary how many people don't know what they're required to have this done after turning 5 to 45. Wow, I did not read that. It's scary how many people don't know why they're required to have this done after turning 45. So I think a lot of kind of like within the last one of people just don't know. You don't know because it wasn't explained to you. And it's very intimidating to be like, please halt, because they usually say, I ordered your labs as they're walking out of the room, or like, don't forget your colonoscopy. And then they call you, but they're leaving the room when they do it. And it's awkward to be like, oh, wait, please come back. But please say that. Please say that. And you should always know what procedure you're having. And you should be able to explain it back to your healthcare provider in your own words. And if you can't, I feel like they have not given informed consent well. Before ever, like I always viewed a good standard of practice, and I learned this from the surgeons at the hospital I worked at, was the parents, because it was peds, needed to explain back to them what was happening in this procedure in a basic way to prove that they knew what it was. Exactly, Lola. Teach back. Like, please explain to me what is happening here. And if you can't do that, that's not your fault. That just means it wasn't explained to you well. And they might need to explain it twice, because the first time you hear something, it's usually a lot. So you might need to explain it twice and then go see it. Also, if you're very curious, go YouTube it, because almost every surgery and procedure is on the internet, unless that horrifies you. But I like it. Like, I'm going to watch this on YouTube. Let's go see what they're going to do to me.
When you get the black screen that says this may not be appropriate for some audiences, yes, I want to continue. That's the good video.
That's essentially how I go through social media. It's like, this content may be offensive, or this content may be graphic. I'm like, yep, my people. I found my account. Rogan P said, I had a patient tattoo one leg, not this leg, prior to surgery. He was having on the other leg when he was young. He was terrified of the surgeon messing up. I don't want to talk about, I guess we can, secrets of the hospital. How often incorrect things are chopped out of bodies or off of bodies?
You know,
it is not rare.
I want to take a minute.
I'm just going to get mad if we start talking about it.
Well, let me make you a little less mad, because here's the thing. 2 things. They only tell you the bad stuff on the news, and they make it sound worse than it is. And they never come back and give you a follow-up on that.
Mm-hmm.
And the one that was at, it may have been Mama Nurse's hospital down in Florida, they amputated the wrong leg, was the headline. And you're like, oh my God, they amputated the wrong leg. They were going to lose a leg. Now they're losing both legs. The details of the story I read about it later is this was a person that had diabetes. They had bad circulation in both legs. The other one was probably going to come off, but they decided to do this one first because it was worse. Now they didn't do that one. They did that other one, but it wasn't like they had a perfectly healthy leg on one side that's like, well, it says left leg, so let's take it up, So when you hear stories like that, yes, mistakes are made, but sometimes there's more to the story, and the news doesn't necessarily give you all the details. Does that help, Chelsea? Are you a little less mad when you hear that?
Well, no, just what makes me mad is
fail, Scott.
No. You are completely right. That's not what makes me mad. What makes me mad is the public perception, and like going back to like Redonda Vaught, and how people don't know that mistakes like this are made a lot, but some people get more flack for mistakes than other people when they might be on the same level of terribleness or something. Like, that is what upsets me, is that people I don't think realize that the amount of mistakes that get made. So
And I feel like we talked about that at one point when we talked about healthcare, like settling in hospitals. Have we talked about that before? I feel like we have. Like when you settle your lawsuit with the hospital, like when an error occurs, and then you can never really talk about it because hospitals are doing that all day, every day, because mistakes happen. It's just very, very obvious, like Chelsea said, when it's the wrong leg or something like that. But yikes. So this does happen. Not
yeah,
like every day, but it happens.
sometimes mistakes in the hospital. Maybe that's a secret we can tell from behind the scenes. You don't know unless you're in on our side of the bed rail. Mistakes are made a lot. Oftentimes it's I gave 40 milligrams of Lasix instead of 20 milligrams of Lasix. Okay, now we give Lasix. That was one of my early med errors in my career, and I asked the doctor, do you want to change the order to 40 to cover me? Or if not, I can write an incident report either way. And sometimes they're like, yeah, that's fine. 40, 20, it's the same thing. Or sometimes they'll say, nah, she's naive. This is the first time she's gotten it. It really needs to be 20. I'm like, it was my mistake. I'll write it up. But we give 20, 40, 60, 80, 100 milligrams, depending on how much the patient needs. So 40 wasn't like an overdose or anything. So a lot of mistakes are things like that. That said,
yes, most of them are not life-threatening, but
my back surgery, they came to me after my back surgery and they said, we need to let you know that we found out afterwards that the instruments that they used in your surgery were not properly disinfected, sterilized.
Oh boy.
So we're going to give you antibiotics IV as a precaution, but we need to let you know. And I'm like, well, okay, as long as you make it right and give me antibiotics, and I'm in the right place. If something bad's going to happen, you're going to catch it and you're going to hopefully save my life. But everything was fine, and the doctor felt bad about it. I'm like, well, you're not the one that sterilizes the instruments. But
can I be moved from the backstage? I had to switch to my tablet. Sorry, I've been like waiting 20 minutes. My apologies. My computer's really like overheating, and I switched. I'm so sorry to be annoying.
Here, I'll move you. Maybe that worked.
You can move around.
Oh, there we go. Okay, perfect. Yeah, but I think just in general, mistakes happen a lot in the hospital. It is a environment with many, many moving pieces. That is why there are so many other safety checks in place. Lola had mentioned that there's like a timeout in the OR, which is a time when you kind of look at everything and you say, like, is this the right patient? Is this the right procedure? Is this are we doing this on the right body part? There's lots and lots of checks in place. And that's why. So if you ever feel like something is so redundant, that's why, is because there are so many moving parts and so many people are doing so many different things that people just usually in the healthcare system want to be overly sure so that it doesn't go wrong. So when you get your medicine, that's why they're scanning you, they're checking you, they're asking your name, your date of birth, they're going over it again. And you're like, goodness gracious, you did this 8 hours ago or 4 hours ago. Why are you asking me all of this again? That's why.
It's still me.
They just want to
We're here an hour ago. It's still me, but yeah, they've instituted a lot of changes since things like that have happened. Now, if you've noticed, if you've ever had surgery, your doctor has to come in and either sign on your body the part that's going to be operated on, or there's a mark that they need to mark before surgery. And there's that timeout before a procedure. Everyone stops what they're doing, including the patient. They're like, what's your name? What's your birthday? Why are you here? That sounds right to me. Everyone, are we in the right place? Is this the person you were expecting? Are we doing the procedure that, and then they go ahead and do it. And it may seem silly, but it's a ritual that's probably saved a lot of people's lives and limbs.
Yeah, for sure.
And be there. Like we've always said, ask questions, and in the hospital, bring someone with you. Oftentimes you're not in the mind space to be able to process all this. And I don't mind. I've never minded when patient families are like, and what are you giving her? I'm like, I never say, well, it's none of your business. I'm the nurse. I know what I'm doing. I've never said that. It's always, I'm happy to tell you, yes, the doctor ordered, 2 milligrams of Dilaudid IV. That's what I'm giving. This is Dilaudid. If you'd like to read the label, I'm happy to share that with you. Ask questions. That's fine. It keeps me honest.
Or I just verbal diarrhea in front of people. I'm like, whenever I walk in the room, I'm like, I'm just hanging another bag of your fluids. You know, they haven't changed. They're the same as they always were. Or like, hi, this is what I'm giving you, especially with like kids. I found like, because parents, you obviously want to know what's happening with your kids. So maybe that's a peds thing, but I just always like verbal diarrhea. I'm like, I'm going to do this. I'm going to do this. I'm just going to clean this really bit right here. I'm going to drain this. Oh, look, it looks great. It's the same color. We have more, we have less. This is nice. Like I just verbal diarrhea. One, because sometimes it's just like, you don't like, what if you don't know what else to say? But two, it just lets them know like what you're thinking and like what your thought process is. And it's reassuring, even if your child is a pediatric, like a tiny little baby, or they're 45 and you're also the parent of that patient. Like you always want to know, I feel like.
I totally agree with
ease.
you.
Yeah, it puts them at ease.
On a coma.
Yeah,
And
if you're in a coma,
it
just
saves
do it
them
the same.
time. It saves you time, because instead of you having to answer those questions afterwards, you're doing it as you're performing the procedures, and then you don't have to do it again.
And it's a good check too. I just happen to think of this. So new nurses, here's your first little tip: narrate your care as you go. Do your care out loud. And it also is a check on you. Like if you don't know why you're doing it, maybe you shouldn't do it, or maybe you should find out why first. So, you know, if you can't say I'm hanging fluids because you're still dehydrated, you're like, I'm hanging fluids because the doctor ordered it, then maybe you need to go back and check and have a little talk with the doctor or another nurse and find out why you're doing what you're doing.
And a really good place to look for if you don't know why you're giving a certain med is look in the healthcare team's progress note. So under the intervention part, they will list all of the things that are going on, and you can just like Command F to find the medicine that you're giving, and it'll show you exactly what you're giving it for, and it'll say, we're giving this for this. And then you'll be able to kind of look at what that medicine does and put it together with why you're giving it. And that'll give you, that's like the easiest and quickest way versus trying to look up what this medicine exactly is, what its mechanism of action is. Cause sometimes it's weird. You know what I mean? Like we gave some meds that were like, it wasn't, you were like, well, this is Lasix. And you're like, but I don't really know, especially in the beginning, you're like, but I don't really know what this is exactly for. Like what exactly is this supposed to be helping with? And then you kind of know exactly what, you know what it does, and you know what it's supposed to be helping with.
That was oddly specific, Liz.
Well, I'll give an example of why that's so important. So I teach nursing students and I do clinicals for them. I think this was actually a GN, and I was just letting her do her thing, of course, observing her. But so she went into a room and she told the patient she was giving him gabapentin for seizures. But he got so mad. He's like, I don't have seizures. You don't know what you're talking about. Get out of here. I want the other nurse. So for, if you're in healthcare, gabapentin is given primarily for neuropathy pain or pain. So that's why he was getting it. So that's an excellent point, Liz, that if you make sure you know, because a lot of medications, for example, trazodone, a lot of times it's being given for insomnia versus depression. So make sure you know why you're giving it, because you are supposed to tell the patient why, here's this medication, the reason for it, exam. So yeah.
Yes, exactly. And it really does because people are going to ask you, they're like, well, why are you giving it to me? And so many of them have many indications. And then you're like, well, if this lowers your blood pressure, they're like, I don't have problems with my blood pressure. Thank you. Like, well,
if I could add on like a little subtopic, it would be to also like manage expectations or talk to your patient. And this might not apply with a lot of other disciplines, but I feel like it would. Like try to foresee on the horizon things that might occur and front end that information while it's not happening. So like in my world, we're like foreseeing possible emergencies in the future, and then front ending information about that. If lots of people come in here to help you, this could be what's happening. And we might turn you a million different ways like a rotisserie chicken, and this is why we might be doing that. Or you have a lot of amniotic fluid. So when your water breaks, there is a small risk that the cord would come out with that. And then that would be an emergency for us. So we would have a lot of people come in here. So that if it does happen, you can say, hey, remember that thing that we talked about? Well, it happened. And so now this is what we're going to do what we talked about. And so that can be really helpful, I feel like, for patients as well.
Oh, for sure. So, and you explained it in a calmer time when they could process it versus like in the middle of panic.
And
sorry,
Bridget's getting fired. This is unacceptable behavior.
And even just to save yourself from getting yelled at by the patient in the ER, God knows there's so much waiting. So I go in, I do my assessment, the doctor comes in, I go and draw blood and everything. And then I've always told them, okay, now's the part where we wait. And you're going to think we forgot about you, but we haven't. We're waiting on all of this. And when it's back, we'll come back. During that time, feel free to like put the call light on and ask like, where are we or what's going on? I'll be happy to come. But just so you know, we haven't forgotten about you, but this is the time where you just rest. We wait on the lab. And then also in the waiting room, it's like, hi, okay, we're very busy today. Here's what you need to know. You are going to wait. I'm sorry. It's not that we don't take you seriously, but this is the situation. And just try to manage expectations. Like you said, front end all that information.
Mm-hmm.
Sometimes it works and sometimes it doesn't, but it's certainly worth a shot.
Yeah. And Scott, I did have a personal example of why that was so specific. It wasn't Lasix. When I moved to peds, so I did peds cardiology, and we used to give a lot of we gave the kids sildenafil, which is Viagra, commonly known, and we did it for pulmonary hypertension. But on one of my very first days there, I walked in and I said, here's what I have that I'm going to give her. I'm going to give her sildenafil, blah, blah. And someone was like, what is sildenafil for? And I was like, that is a excellent question. I was putting 2 and 2 together and I was like, I don't think we have erectile dysfunction present in this 2-month-old baby girl. I was like, but great question. So ever since that, when I looked very dumb and I was like, I don't know. I will find out, but I don't know. And then we were able to giggle about it later because I was like, do you know what else this name is for? They were like, oh yeah. And then she way overshared about a lot of personal experience with it. I was like, okay, I regret all my choices. So to help avoid putting you in that scenario, we have that. And Montana Gal said the same, like, this happens a lot. I feel like my son was in the hospital for ulcerative colitis and the nurse thought his Remicade was for cancer, probably because she saw Remicade and realized like, oh, it's like a TNF blocker. Like it could be used as an
neoplastic or TNF.
Yeah, an immune modulator, which they can use as part of cancer treatment because it's going to squash your immune system and do stuff to that. But that's not what it was being given for in this case. And that could obviously cause a lot of panic, not only in you as a parent, if you came in and you're like, oh, here's your cancer medicine. And you're like, excuse me, what? Like if that's not at all what it's for. Happens a lot with psych meds too. You don't want to tell someone that it's, they're oh yeah, this is for your like bipolar depression or like something else when really you're getting that for seizures or something, having stepped in that mud many times, friends, just look up exactly what it is.
Also with psych meds, I've seen as well when I was working at a sleepaway camp for homeless kids that they'll tell them it's for one thing when it's really for another. Like, I feel like there's got to be a better way to go about that. Like, you don't have to lie and tell a kid with ADHD that their ADHD meds are vitamin C drops. Like,
oh my gosh. Yeah. No, if you're
sorry, that just made me really upset.
No, that's a really good point. Like that's another thing that I think does happen sometimes is we will beat around the bush and not say healthcare providers won't tell you directly what something is, or like they won't be honest about something in order to code it in something that seems more palatable. And that's awful. Like if something seems fishy to you, don't allow that BS, just ask. And like Lola said, a lot of the answers to all of these things, if you're a healthcare provider, are in the chart, which is very helpful. Let me see. Okay. Number 4. I have been a nurse in nursing for over 20 years, and every day a nurse punches in. They put their life at risk. There is a risk of exposure. I've been exposed to TB many times, meningitis, and hepatitis B, and the risk of violence. I was assaulted when working in the ICU from a confused patient. Very true. I feel like this is anytime anyone in healthcare walks into work, this happens. We have a whole video about this, so we don't have to go into like crazy today. But you can let us know in the chat if you work in healthcare, if you've ever been physically assaulted. You can let us know on the panel if you've ever been physically assaulted. I have many times. And yes.
Or if you've gotten sick, if a patient's given you the flu or something.
Oh, yeah. My immune system working on peds was like,
I know.
It was a tank, especially in the ER. I would imagine yours would be the same thing.
I hardly ever get sick. I get the flu once every other year or something like that.
Like,
and I just figured
my immune system laughs at you. There's no bug that could possibly permeate this No. Now it's gone though. Now I get everything again because now I'm getting all the daycare, like preschool bugs, which is the worst. But yeah, we will link this down below. Second opinion. Can you link the video we did all about violence in nursing? And that way we don't just like harp on it. But this is very real.
There was one time I was in a patient
messy.
room in and out like all morning. And then I don't know if the doctor got a phone call or what, but he put in the order for airborne precautions because the person had TB. And I was like, great. I've not been wearing a mask all day.
Don't you love that? That was
Well,
always the
TB
worst.
TB should be droplet precautions, actually.
Oh, droplet, yeah.
Yeah,
I
but
thought
whatever
maybe
it
you
is.
put in the wrong one or something.
No,
It
no,
always
there
sucks.
was no precautions in there.
Oh,
Yeah.
okay.
It's
Yeah,
always
well, that's the ER. People come in and we don't know what they've got.
Yeah.
I mean, sometimes you can say, wow, you look, you got a fever and all the symptoms, so you got the flu. We do the whole flu thing. Sometimes we don't know, and then the doctor comes in, oh, by the way, they need to be on isolation. You're like, oh, great, I've been working with them for an hour now.
I feel like isn't TV an N95 negative pressure room?
That's
It's
what
I'm
when
losing
I
my mind.
worked, it was.
It's droplet.
Yeah.
It's droplet.
Oh, we always did negative pressure and
Yeah. I think at our facility, now that she mentions it, it was at our facility, it was airborne, and we did have to have them in a negative air pressure room.
yeah,
So yeah.
because it was like that, and then measles and maybe chickenpox.
And then like I think flu is the one that was like droplet, like that one was.
Flu was droplet, but it did always suck when you were with a patient and then all of a sudden they went from they just had the one for poop and you're like, okay,
And
contact precautions.
I think it depends because some like Lola says TB is droplet, others are saying TB is airborne. So I think it
This is
just depends on the
interesting.
facility.
I'm
Yeah.
going to apologize because I'm looking it up now, and the first thing that pops up is airborne precautions. So I should not be as sure of myself sometimes as I am.
Fired.
I was wrong. I'm sorry.
Okay.
To err is very human. Yes, but I always hated it when you would go in and you had like C. diff contact, and then all of a sudden C. diff contact turned into full on like droplet. Like it went to droplet and then it was immediately airborne. You were like, what do I have now? Like the patient that was just like spitting in my face. Like, what do I have? Okay, good. Perfect. There's a vaccine for that, I hope. I hope I have the vaccine for that. But yes, so this one is real. It's a hot mess. It is a hot, hot mess.
Lots of bugs. Lots of bugs.
So just prepare your immune system and then you will be unstoppable. Okay? You'll be unstoppable until preschool. Scott, would you like to read number 5?
Let's see. What's number 5 say?
Oh, wow.
Medical social worker here. We don't get a lot of credit for the things that
for
we
you.
do, but we are a really important part of the interdisciplinary team and actually do a lot. We're usually thought of as the people who call child or adult protective services, which we are, but that's such a small part of our job. A lot of times we are the ones writing letters to insurance companies to get medications approved when they're initially denied. We also provide a lot of education to patients and families after they receive a new diagnosis, and it all seems overwhelming and confusing.
Yes.
Lots of people, I had a nephew. I don't know what he wants to do now. He just turned 18, but he was talking a couple of years ago about being a surgeon, being a doctor. And I said, that's great. I said, make sure you take a lot of math and take your math and physics and everything and prepare yourself. But I said, there's a lot of jobs in the hospital you've never even heard about. Doctors and nurses, yes. But then medical social workers is part of that category.
Yep.
Maybe
I don't know if I don't know if I can personally recommend becoming a social worker because I cannot fathom being a social worker in the hospital. I felt like every other thing that came out of my mind was, we have a wonderful social worker who I am going to have you talk to about that. And they are like magicians. And I don't even know. They would come in and they would fix all of the problems. You're like, my patient has no ride home. They're like, that's fine. We'll get them a ride home. Oh, we also found them a house to live in. We've set up oxygen for them so they have that when they get home. And here's some clothes for them. Oh, and we've repaired their relationship with their mother. And you're like, wow. Like that was a lot. Thank you so much.
I only called you an hour ago. That's amazing.
Exactly. Like they are magicians. They also come to all of your codes. They help in communicating if patients have passed, if they've died. I feel like they were just everywhere. They dealt with all of the situations basically when we were like, this is what needs to happen, but I don't actually know how to implement those changes. Social work is the one that does it. So, and they're also very, very low paid, like poorly paid usually. the hospitals burn social workers out so fast. They usually are there. They finally get their feet under them and then they leave for that exact reason. But we love you, social workers. But like Scott said, I guess a good secret about the hospital is there are so many other jobs. Like, I feel like when I was looking at school, I was like, you can be a nurse or a doctor.
Right.
Period. And there's like so many, if you want to deal directly with patients, like respiratory therapy, there's
OT.
Yep. ECMO. I have a friend that's an ECMO technician, like a very specialized thing. Like I had just absolutely no idea. So just go in and explore other, you know what I mean? Like ask your healthcare friends, what other jobs are there? You know what I mean? Do you hate your job? Great. What other jobs are there? Let me see.
Or look at the hospital's job listings and see what they're looking to hire.
Oh, that's a really good idea. Yeah.
Yeah. Well, like the discussion we had about would you do it over again? Nursing, would you do it over again? I think some of the happiest people are the rad techs. They take x-rays, they take CAT scans and ultrasounds, and, so they get busy like everyone. I don't know. I just think that might have been a good option for me if I hadn't done nursing.
Lola agrees. Radiology. Yeah, she's with you. Who said Kate? Oh, I got hit by an angry patient who then ripped the fire extinguisher off the wall and began swinging. Unfortunately, a patient's family member took him down, until security and I think law enforcement arrived. I am sorry that happened to you. That is awful. And also that happens.
Oh, hey, someone asked what is C. diff? Can I explain C. diff?
Please do. Please do.
We normally have bacteria in our colon, in our gut, and it helps us digest food, and they're in balance. But sometimes when you take antibiotics, especially, they get out of balance, and the good bacteria kind of go down, and then the bad bacteria can start to grow. And Clostridium difficile is the fancy name for this particular microbe that starts to grow, and it has, I think it's exotoxins. It really irritates your bowel, and you get this terrible diarrhea everywhere, and it stinks to high heaven, and it's very contagious. So that's one of the things when people have that, they have to be on contact precautions. We got a gown, glove, mask, the whole thing to go in and take care of them because we don't want to get it on us, in us. And hey, quick tip. You know how you gel in and out with the hand sanitizer for C. diff? Hand sanitizer does not work. It has to be soap and water.
Yep. To get C. diff off, it has to be soap and water. You did an excellent job. And to clean it off of a surface, it has to be like bleach to clean it off. And if you ever, fun fact, here's a fun insider scoop. We have robots in the hospital sometimes, and they're like laser alien robots. And you lock them in a patient's room after they have C. diff sometimes, and they shoot their laser beams all over, and it UV scours the room or something.
Oh, wow.
Oh, it was absolutely fascinating. It would roll itself in, like it would just like drive over, and it pulled into the room, and you closed the door, and then you would just see like laser. You had to pull the curtains shut, otherwise it would like blind everybody. And it was like
a black light, but for C. diff.
It was amazing. So that happens.
So not laser, but ultraviolet.
Probably. I don't know. I called it the laser robot.
Okay.
So that's all I needed to know. And I would take my children who were ambulatory, and we would rock by it, and I'm like, look under the door, even though it was probably like, please don't look at the light. We were like, look under the door.
All of Liz's patients went blind.
Yeah, exactly. It's weird that all these patients that she has goes and does this.
Uveitis all of a sudden.
Yeah. Also, Maddie, thank you for the super chat. That was super sweet. In my town, a master's level social worker and a licensed social worker pays $24.40 an hour. The pay is so low. That is so low. I am so sorry.
No bueno.
That is a mess. Oh, Maddie, another super chat. Thank you. That was an oncology position as well. Oh, so wow. I don't think you can afford the therapy you would need for that job on that salary. And I'm sorry. Thank you for doing what you do. I hope you are in a better paid job now that respects you, because that is horrific. Social workers do everything. Friends, we need to pay social workers a whole lot more. Nate said, what fancy hospital are you in? It was a peds hospital. They cared about their babies. They were like, we'll buy you the robot. They also have food delivery robots in a lot of places. Like robots are starting to take over the hospital, and it is creepy. Okay. Have anyone ever seen a robot in a hospital?
No.
We had one, and it would roll around with all the linens, and it would like talk to you. It was like, something about like blah, 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 whatever its name was, coming through, like, please evacuate the area. It would just come through, and it had linens, and it would stop, and you could go and you could grab them and you could take them over. Absolutely terrifying, but fascinating. Absolutely terrifying. let me see. I think, yes, social workers, we appreciate you. Anything else we have to say or fun facts about social workers?
Just thank you.
It reminds me to remind people to ask who a person is when they walk in your room, because we all look alike. And someone like this wonderful social worker could walk in your room and you think they're your food service person or your, nurse assistant, some CNA, just ask who's in there and try to keep track of who's who.
Yep. I usually had them come in and then people were like, can we have that nurse back? I'm like, I'm sorry, you're stuck with me, as that angel of a human is not a nurse, and I cannot allow them to take over for this. And I don't want to do her job. So no, but yes, wonderful humans. Bridget, would you like to read this one?
My sister and I are 4th generation nurses. I have been working in healthcare for 43 years. We have always been short-staffed. We have never gotten 15-minute breaks and rarely get 30-minute lunch breaks where we are not still doing work-related activities like charting, answering the phone, etc. Our work is emotionally, physically, and psychologically exhausting. We suffer from chronic insomnia and rarely take as good care for ourselves as we do for our patients. I can completely relate to this. I have ADHD, and when I was at work on bedside, I would hyper focus to the point where I wouldn't even text my significant other all day. That would drive him crazy. But we just don't have the time, and we're juggling so many balls that and I think California, I think Nurse Adrian and Nurse Scott, you were mentioning that you get breaker nurses. We didn't get breaker nurses. And depending on who is taking over your shift, since we don't have breaker nurses, not your shift, but your assignment, if I knew they're not very good nurses, like me in good conscience, I don't trust them to watch my patients when I'm at lunch. So I would literally just stuff like granola bars in my pocket and just eat as I'm charting. I know that's not healthy, and I don't recommend that for people, but I can relate to what this person was saying.
Yep.
Same.
Yep. Yeah, I was joking on Instagram the other day. I had a robot, or not a robot. I'm looking up the robot so I can show you. I had a what I called a hospital lunch, and it was a tube of Mentos that I found in the vending machine because that was what they had. And I was like, oh, this throws me back to when I would have like Diet Mountain Dew and Mentos for dinner. And I was like, wow, this is so great. As I'm telling my patients, like, you really need to sleep more and try to eat a vegetable. They're like, what'd you have for dinner? I'm like, I don't want to talk about it. But you're exactly right. You can't hand them off to anyone if you don't have a breaker, because you're handing your 5 people or 6 people or 7 people or 8 people off to someone else who has 5, 6, 7, or 8 people yourself. And that just doesn't work. Scott lives in a different situation.
I do, and I know I'm lucky to do that. I brought it up before, and they're like, "Well, you don't understand how bad it is in the rest of the country," and that it's not right. Yeah, I've been lucky. In California, we have state mandated nurse-patient ratios. Not everyone and not at all the times can we adhere to those, but they do try. Yes, there's someone scheduled to be break relief, comes in at 11 o'clock, starts sending people to lunch every 30 minutes. It's rare that we don't get a break, but that's something, new nurses be asking when you go on interviews. Talk to the nurses in that unit and say, how often do you guys get a break?
Yep. And ask the nurses, don't ask the people you're interviewing with, because most of the time, here's a fun fact. We don't get paid. We just take the pay. We don't get paid for like half an hour to 45 minutes of working, because you then, because if you go back and you say, hey, I didn't get a break today, they will jump over backwards to say, that's your problem. You should have negotiated one better. Yeah. And they'll go in, they'll yell at your charge nurse, and they'll do everything. So I would say some people will write it down in their hospital. Culture might be different, but at our hospital, I would say I never really took a full break, but I never, ever got paid for it, or my 15. We just worked through them, even though they took it out of so you worked a 12-hour shift and you were only paid for 12 hours, but you were there from 7 to 7:30. 7 p to 7:30 a. So there was a half an hour where you just didn't get paid. And that was just like everyone accepted it.
Exactly.
We always had a form to fill out that was a missed break form, and you had your charge nurse sign it, and you turn it in and get your extra half an hour pay for that shift. Or you leave right at 7 o'clock. You arrange so that you give a report within 15 minutes or whatever it is, and you get out of there.
Mhm.
Yeah.
I think that's why it's important to advocate for legislation to be put in place, because like California, obviously, like we get in trouble. And then I feel like in the rest of the country, we actually, like Liz was saying, we get in trouble if we fill out those forms or if we leave late. Like, and it's almost like bullying. Like they will, well, if you're not going to be able to do this by this time, then we're going to have to let you go, because they have so many people that need jobs. Like we're just treated like we're so dispensable.
Yep. Montana
Well, I
we're
feel
expected
lucky
to say
because
we take a break, but not take a break. Oh, sorry, Chelsea.
no, I feel lucky because my hospital, I mean, we did not get like I don't really get breaks. I mean, if I'm eating lunch, I'm still watching my strip, but we don't, like, I just hit when I clock out, it'll ask me, the time clock asks me if I got a lunch that day. I hit no, and that's that. Like I've never gotten in trouble for, I've never gotten talked to about not taking a lunch. We do sometimes get talked to about slack time, is what they call it, like time after the shift, or if you clock in before like the time or whatever. But they don't, especially like the last couple of years, they have not said much about slack time at all, because we're so short staffed, and we're just kind of like, well, I'm here for another hour after I'm done charting because I didn't have time actual shift. And so they've kind of like quieted down about that. So I guess, I don't know, I'm lucky they don't really say anything about if we say that we didn't take a lunch. So
Just so you know, when you're looking for jobs, and I don't know if it's only in California, but you know, my job down at a specific hospital in Los Angeles, who is very well known, we worked a 12-hour shift in the ER, and we had a half an hour for lunch. Half an hour for breakfast, an hour for lunch, and then another break in the evening. I don't know if it was 15 minutes or half an hour, but yeah, it was nice. Just like you get there at 7 o'clock, you get going, and then it's like, oh, someone comes in like at 9 o'clock, and you're like, go for breakfast. You're like, oh, okay. I mean, I kind of just got on a roll, but I'll go do that. And you go to the cafeteria and you come back, and then you get going, and then noon rolls around a couple hours later, and you're like, you get a whole hour. Of course, it takes that long sometimes to get through the line at the cafeteria at a large hospital. So there are
that's amazing. Yeah.
It was. It's definitely not the rule. But listen, guys, as you're looking for jobs, these are the kinds of like quality of life questions you might want to ask as you go to different places. And if you have to drive a little bit further to go to work at a place like that, it might just be worth it.
Yep. And ask about just ask about that type of stuff. Also, Bridget had to go, but thank you, Bridget, for being here. Everyone go check out Bridget's things. She does awesome things on the internet, as does Scott, and Chelsea will soon. And Mira, well, she had to go too. Her internet was being garbage. Check them all out. But we didn't even clock in or out at my hospital because they framed it as you're a professional, so you don't need to. But what that really translated into was you're going to be getting there early to look up your patients, and we don't want to pay you for it. And you're going to be staying later to finish up your charts. And it's not worth filling out this huge form that you had to fill out explaining why you were clocking out 5 or 10 or 15 or 20 minutes late. So you just didn't.
I've been places like that. They required you to swipe once during your shift to prove you were in the building.
Yeah,
and they would just pay you for that shift. But then if you did work over, I'm sure there was a way to go in and say, oh, by the way, I didn't get out of here until 8 o'clock.
Yeah, we did that all the time, but we barely ever wrote it down.
Because people get paid for your work.
Be very, very, pay for your work. And if you're noticing that your health is failing you because of your job, you need a different job. No job is worth your health.
So true.
Okay, friends. No job is worth your help. Nate said that's actually very illegal, but yeah, it's so hard to report and fix those things after fear of reprisal. Yeah. And it's hard when your only other option is, you're going to be taking on, you are going to be taking on 8 other patients in that, like when this offering is, oh, well, now I'm going to have to be doubled up with a whole bunch of other patients. Like the solution isn't really feasible. You know what I mean? And that is just not ideal. All right. Chelsea, can you read things? Do you want to read one of these, or are you still out and about?
I will not read
Okay.
that if that's
Okay.
okay.
Yes. It sounds like you're in your
It's too
car.
small
Yes.
for me to read
Yes.
anyway.
That is totally fine. So 7, I work in HIV testing education. I test hundreds of people every month. Sometimes the people who will be positive are obvious from the moment that they step in the testing room. Most of the time, they're people who test every few months and just had that one risky encounter. Either way, telling someone that they now are living with HIV is devastating. I try so hard to keep my emotions neutral and to stay upbeat as I walk them through their next steps. But honestly, I cry with most of them most of the time. It's the stigma surrounding the diagnosis that people fear the most. The virus itself is easily controlled with medication, but the judgment of others and the lack of basic HIV education in this country makes a lot of people afraid for their safety and privacy when having to disclose their status. And I think the thing probably that might be shocking for some people here is just the amount of times that healthcare providers also get very upset and cry about things. You know what I mean? Whether you're leaving the room afterwards and you're having a moment or, and this will depend on your personality, but I have cried many times with patients, especially in primary care when you got to know them and you had to tell them, hey, this came back bad. Like this doesn't look good. That a lot of healthcare providers get quite emotional too. A mess. I think Scott's a little bit more stoic if he wants to share that perspective, but
I do, because it bothered me for a long time. I'm like, am I a robot? Because it almost feels like I don't care, but I do. I'm just not emotionally invested in every patient that comes into my ER. And then, but I recognize this is something happens. I recognize this is a sad situation. This family's going through a lot. And I realize, well, my emotions come to me as thoughts, maybe. They don't come as bubbling up tears. They come to me as thoughts that this is a very sad situation. And it's not that I don't care. It's just that I'm put together a little bit different. And, but, you can't look down upon a fellow, healthcare worker that does get emotional, because they're human beings. It's what I keep saying. Be human at work. Be kind to each other. Ask people, do you need something? Say, I'm really sorry you're going through this. Don't just be a robot. And speaking of robots, don't be a robot.
Yes.
And part of that is sometimes it's going to get to you, and you need to honor that and heal that as it comes along.
For sure. Speaking of robots. So these are some of the ones that will carry the stuff. So they will just go walking through the hallway. You can load anything onto that. This one's obviously carrying, who knows, some kind of equipment. You can put linens in there. I'm sure at night shift, you can put you in there and see how far it will take you. Please
put your pediatric
do that. You can put your peds patients in there and just be like, please take them to radiology. Just kidding. We don't do that. But if someone's ridden on one of these, please let me know, because
that reminds me when I had my tonsils out. I was in second grade, and those cribs, they're not cribs, but I guess they're like peds beds, but they have the rails up on the side like a big crib. And I remember waking up after surgery and that just scared out of my mind.
Oh yeah. Yeah. Yes, they can be transporters. That would be a creepy place. I've heard of.
We are joking about the patient, so someone always has to go with us. You don't send a patient by robot, not yet.
I have heard of some places that do use them as transporters, like when the bed, especially when carrying people who have passed away.
Well, then you don't have to worry about taking them to the wrong place or pushing them into a wall.
Exactly. Like I have heard of that. And sometimes a lot of times, here's an interesting thing. Some hospitals will really try to disguise bodies. They have you will usually, if you are moving a body off of a unit, you have maybe even seen that in a hospital and you didn't necessarily know, because sometimes you would put them on, they would put other boxes or other things on top of it. So it looked like you were just transporting goods on like a long stretcher full of boxes, because you would kind of put it over the stretcher.
I'm sorry I can't share my screen because I just Googled one, but yeah, they just look like a big rectangular something with a sheet over it.
Yep. And so it doesn't look like anything like that. Or there are different elevators that you take within the hospital when you're moving patients that you would never see. It's in totally different areas of where visitors interact with. Like there's a whole hospital network that you never see, like back doors. It's
Employee
like
elevators, staff
the
elevators.
employee elevators, the employee hallways, and it is a happening little place. But that is where all of that happens. That is where a lot of patients are moved around through. That is where you always immediately try to get a body out through that way. But that's why you don't see all of that stuff. It's because it's a whole hidden back world.
If there's carpet on the floor, you're not there.
Yes, correct. Oh, I hope
I'm
so.
so
Tile
sorry
floor, that's our area.
that I ghosted. Turns out my entire neighborhood has a Wi-Fi outage, so I was actually able to grab a hotspot from my mom. So I do apologize
cool.
for any interruptions, and I didn't want to.
Oh no, you're totally fine. You're totally fine. And oh yeah, Naya said there's usually a hospital between tunnels between buildings too. Yes, look for the tunnels or the airway, like if you have an airway one. But yes, there's tunnels connecting all of your hospitals. If you go down to like the basement level 1 or 2, it's there. Also, morgues and the place where the hospital makes food are almost always next to each other because they both need refrigeration. So they're usually like right next to each other, which is just odd when you go down to the morgue and right next door they're making all the food, and it's just a weird conflict of smells. It's just odd.
Smell.
Yeah.
More
and
smell.
Like the smell of like how it's like cold and refrigerated, and like sometimes if you had to put some kind of like a don't decay fluid on there, it was just a weird combination of, it's a weird hallway.
I haven't spent a lot of time in the morgue, but I don't remember it smelling one way or another.
We had to like at my job where a lot of patients passed away, we had to transport them a lot of the times and take them down. So
my first job was a transporter in the hospital in college. So
yeah. And
things we did.
Yeah. And the morgue was always at risk of catching on fire because the kitchen always caught on fire. And so that's where they would, like, over the overhead, they were like, fire in the whatever. Like,
code
yeah.
red. There's code color.
Code red. Yeah. Code red.
Code red.
B1.
B1. Yeah.
Yeah. Basement level. B1.
Hey, that might be something, if you, different hospitals have different systems, but they don't want to announce overhead. We had a bomb threat. So they have codes for, everyone knows what code blue is now, but code red for fires, code orange for hazmat spill. What would they, like triage internal was some kind of internal disaster, like we lost water or we lost electricity in part of the building or whatever. Triage external would be like a multi-casualty accident, like a plane crash or something, what else?
Code pink is a lost kid.
Yeah, code
pink. You guys haven't changed to our hospital system in the last couple of years, changed to plain language codes. So the only thing that's still a color is code blue. Everything else is plain language. So we would say like intruder or like whatever, open fire, whatever it is, we say plain language. So missing child, and then they would say like last seen on 3rd floor, red shirt, approximately
that's like
7
really
years
nice.
old, or what, like everything is plain language.
I really like that. That's awesome.
Yeah.
Yeah. Yeah.
At the same time, you're sitting there, visiting your grandmother who had her hip replaced. You don't want to hear there's a child missing in the hospital and you've got an assaultive patient with a weapon on the 3rd floor. And, that could be a little, that's why they do it, is we don't want to like disturb everyone who's there.
But I feel like they probably know, because all my patients, whenever codes were called like that, like we had code silver was like, there's an active shooter in the building, or something like that. They were all like, what's that mean? And you were like, well, I'm just going to close your door. I'll be right back. Everything's great. All is good. And I'm also realizing that we're going to do this in 2 parts, I think. So maybe we will do this again in a week or 2, just so they don't back right to back, because I feel like we've had lots of good conversations surrounding this and I don't want to like zip through the rest of them. So should we take a vote? Do you want to just wrap like for 10 minutes?
I love that. Less is more.
Okay.
I feel like quality, you enjoy it. And then sometimes it's like, can become a little too much for some people. Sorry if I'm having an unpopular opinion.
No, that's perfect. And so we can do
That's a terrible opinion. Go away, never come back.
Awful opinion.
Good feedback.
And then we can do like a Q&A or something for a couple minutes. But okay, yeah, do it again. Okay. Montana Gal and Mira, you've unanimously made the choice for us. That's obviously representative of our entire group. This was a great sample size. Thank you for voting. But I think
those research skills, Liz. Wow.
Thank you very much. But I think that'll make it so that we can actually have conversations around it, because we ended up being able to go on a lot of tangents, which are my favorite kind of conversations. And if you did like this, give it a like. That'll tell YouTube. It's free, which is great. And it tells YouTube that you liked it and other people should watch it. And you just do it an odd number of times. Odd number of compressions will save the video's life. So just do it that way. But do we agree? Consensus from Chelsea and Scott?
Yeah.
Okay. You look disappointed.
Yeah.
Okay. Scott, you look disappointed that we're not getting to more of these.
I'm here to whatever, to just take
We are
part in
here at your leisure.
I mean, you're the boss. That's a terrible choice, but you're the boss.
I serve at your pleasure. So
I deserve to get to listen to your tangents because they give me hope.
Okay, good. I'm glad. Because I think we can change healthcare. I think we can do it. We just all have to kind of, get grumpy together, and let's get grumpy and do something about it. We can do it. So yeah, any general questions, comments, concerns? How are we feeling? What are we doing this weekend?
it is Fleet Week here in San Francisco. So we have the Blue Angels flying overhead and practicing, and there'll be a show this weekend. And this is the only week of the year where I can use the line, "Hey sailor, you new in town?"
Yeah.
That's so cool.
That's amazing,
cool.
Scott.
It's a lot of fun. And I play with the local LGBTQ band. I'm on the board of directors as well. And last night, they one of the things they do in Fleet Week are the Navy bands and the Marine bands play in different places around town. And our band got to play with one of their bands over here in the
that's cool.
Yeah, it's a kind of big PR week for the military, but the arts are included too. So it's a fun week here.
Well, that's way better. When you said Fleet, all I think of now, because I'm a ruined human, is Fleet's enema. And I was like, it's a weird public. All of San Francisco's just going to clear themselves out. All right. In San Francisco, it is Fleet Week. We're going to be
evacuate your bowels. We're going to cleanse and detoxify.
It does sound very San Francisco, though. We're all going to detoxify at the same time, clean ourselves out.
I miss that stuff. I'm so jealous. It's my favorite city. I was just there this past summer because I was there the summer before, and I loved it. My mom uses a cane. It's super accessible. Love your arts and culture, and I'm just so jealous.
It's
I'm
an
in
amazing
New York City, so not as cool.
The weather is usually good.
Oh.
It's just a very interesting city with a lot of history. Like a lot of cities have history, but it's just kind of quirky. Whimsical things happen, and it's a great place. I just entertained over the summer a friend of mine from the Midwest and her partner, and showed them all around. They're they just ate it up. Lots to see, lots to do.
That's awesome. I love that. I love San Francisco. We used to go up because I grew up in Southern California, and they had planes, that just jutted from Long Beach up to San Francisco. Mm. And
the weather here is a lot like Long Beach.
Mm-hmm. Mm-hmm. Michaela said I have a cousin named Senna.
It's their last name.
I hope so. Senna's a drug that will help you go to the bathroom. I had a patient one time of a parents, and they did not end up naming her this, but they thought that English was not their first language, and they had heard the name chlamydia, and they thought it was beautiful, and they wanted to name their sweet baby girl chlamydia because they thought it sounded like a rare flower. And I was like, please God, no. Don't.
Yes,
no.
It is. It is a flower. It's not very rare.
Yeah.
Flowers in places you don't want it. It's unfortunately pretty common.
Yep. And so having that conversation via a translator was very interesting. Because I was like, we really need to discuss this. This needs to
I took care of some Amish patients one time, and I almost fell out of my chair when they told me that they were going to name the baby Tequila.
Oh.
And I had to like talk with my friends, with my nurse friends, and like, do I tell, like, what if they don't know?
Uh-huh.
I don't
Yeah.
know how sheltered their life has actually been.
Yeah.
Do they know that that's a liquor?
Saw it on a billboard. They're like, oh, that's nice.
I ended up like somehow breaching the topic with them, and they're like, no, we know, we just like the name. And I'm like, okay, cool.
That's amazing. Also, I need to know if everyone else has a list of names hidden somewhere secretly where HIPAA can't get them, but that you sometimes just read it and you give yourself a giggle. Like, do we all do that? Or is it just me? Because sometimes the things that people name their humans is just, it is just, don't ever write down patient names. Don't do what I do. Of course, it never happened, but definitely did.
I don't remember a lot of strange names,
very-
a lot of strange stories for sure. But I mean, I took care. I mean, I used to work in St. Louis, and when I first started my career, so I took care of Elizabeth Taylor. But that's, you know, a common name, you know, and she probably was older than the other Elizabeth Taylor, the actress. So
I had a lot of
and
very
I did take
interesting
care of actual actresses and actors in Los Angeles.
Were you a set medic?
No, I worked at the hospital they all go to.
Oh, I was a set medic, so that's how I got to like.
Oh, okay. I had a friend who was
There's just free concerts. If anybody wants to like gain healthcare experience, likes free concerts, hanging out on movie sets, and like literally New York City blizzards, go be a set medic.
Yeah, they have a friend of mine used to moonlight as a studio nurse. He got to ride around Paramount in a little golf cart.
That's super cool. That's super cool. CK Medic, the worst name I've ever seen is euthanasia. Euthanasia would be putting a human down, or a dog, I guess. And no, I'm not making that up. Oh, that is, I believe you. Allie Willis had a patient with a 6-year-old daughter named Déjeuner, which in French translates to French.
Déjeuner is lunch.
Oh,
I speak.
That's
French.
cool.
Yeah.
My daughter named her baby doll Dinner. Because I was like, what do you want to name her? I was like, you should name her something that you like love. So she's like, Dinner. So, but at the time she pronounced Dinner Nina. So she was like, Nina. I was like, oh yeah, we can call her Nina. So now she's Nina, and people are like, Nina, and she's like, I don't really know why I called her that. I'm like, because you love food. That's why. Where'd you get that name? You know. Dinner. It's fine. All right, friends. I appreciate you being here. This was fun. We got to go on a lot of tangents. Mira, welcome to your inaugural chit chat of the internet Friday session. I hope you all have a lovely weekend. Yes, happy Friday. Have a lovely weekend. Thanks for sharing your stories with us. Come up with more, friends. We'll come up with more. I'll think of more secrets of the hospital. I'll think of more things and we'll come up with it and we can all share next time. Maybe we can vote on the best secret and the winner gets, I don't know, bragging rights and a thumbs up from Scott and a picture of his dogs, you know, something like that. And yeah, have a beautiful weekend, friends. Do like and you don't have to subscribe if you don't want to, but do like the video. It does help it, or leave a comment or do those things. And remember that you, my friend, are not alone. You are more than enough. Scott, you can do this. You can do patho. Everyone out there, you can do it. Mary, you can do PA school. Chelsea, you can do it. CNM school. Everyone can do all the things and you can do hard things. Bye, friends. I wonder if there's a way to make this happen automatically. There probably is, or I could just be more prepared. We have to do the end screen so the cards can come up.